annual Con. That would be the Concussion Consortium, the Consortium Concussion Conference. I can't say it 3 times. We're thinking about the hashtag being ICON. I'm Geoffrey Lauer with the Brain Injury Alliance of Iowa. I serve as Executive Director, and I'm really pleased to be able to welcome you and thank you all for taking time out of your summer to come and talk about a topic that is increasingly making us squeamish. In 1980, the Brain Injury Alliance of Iowa was founded up in Waterloo, Iowa by families who were struggling to navigate the consequences of both mild, moderate, and severe concussion. And we've been stumbling forward and moving forward ever since. In 1992, the Iowa Department of Public Health inherited the Advisory Council on Brain Injury, and since then we've had a really strong partnership with the Advisory Council, which is currently chaired by Tom Brown. Tom, are you in the room? There you go, Tom Brown, Chair of the Advisory Council. Thank you for coming. We have a partnership with IDPH as the lead agency in Iowa for brain injury. In '96, the President, then Clinton, signed the TBI Act and opened up funding that came into the states, some of which has been the underpinning for the efforts that you see today, which is working on systems change to reduce brain injury and to improve the lives of people living with brain injury, to try to help live well with brain injury. In the 1990s, I'll point out, the Department of Education made a commitment to brain injury through the brain injury resource teams, both in the AEAs and in school districts. And Iowa emerged as a leader in pediatric brain injury in the school system. Sue Pearson, who's not here today, was the Department of Education lead in pediatric brain injury. Some of our colleagues are here today. BIA, the Brain Injury Alliance of Iowa, has continued to beat the drum on mild brain injury. It has been an uncomfortable topic for many to deal with because it hits at the intersection of some of our most sacred spaces, our children, our commitment to athletics, and our desire to want to protect our children while also giving them the opportunities that athletics provide. In 2011, the National Football League partnered with the Brain Injury Alliance, and we were able to pass Iowa's first legislation, the Youth Sports and Concussion legislation that you'll find on the back of your REAP manuals, and I'm sorry, on the inside back cover. I should mention that the trip from Colorado to Iowa from our printers was a little rough on some of our manuals, and so forgive us if you have bits of granite inside, but those are gifts from Colorado if you have that sand. We're talking with our printers. The good news also is that we're about to reprint our REAP manuals with some updated information. In 2015, and this is the end of the history lesson, we identified that in Colorado there was a best practice emerging that had been adopted by 9 states. Iowa is now one of 10 states that are using the REAP program for remove, reduce, educate, adjust, accommodate, and pace in terms of supporting student athletes and others with mild brain injury as they return to learn and return to play. Dr. Karen McAvoy and the Rocky Mountain Hospital for Children have made an investment and made a national footprint, which is now more than a footprint. It's like a large gorilla print, a big 900, which is great. And Iowa is fortunate to be working with Dr. McAvoy on the next iteration of the REAP manuals. There are 44 million children playing sports in the US. Athletics is critical. It's unarguably critical to psychosocial and emotional development. I have a teenage daughter who I don't know where she would be without athletics. Children have smaller brains than adults. There's a lot more room for kids to have concussion. We're still hearing of the short and long-term impact of both concussion, which is mild TBI, and also subconcussive, basically under the radar injuries. What is the impact? We don't know. We do know that the buzz continues. The July 25th Journal of the American Medical Association had an article that found that 99% of the brains that they studied of NFL players came out with chronic traumatic encephalopathy. Arguably, they had a very limited and perhaps skewed vision of the brains they studied, but we know that long-term football play has some impact. This morning I'd like to thank and invite to make some opening comments 2 of our flagship collaborators, the Department of Public Health and the Department of Education, who have partnered with us and with Dr. McAvoy and others to get the REAP concept, the REAP protocol, as Iowa's standardized return to learn and return to play protocol. Gerd Clabaugh is the Director of Public Health. He's been there for a number of years, appointed by Director Branstad. He's got a long, career-long history in public health, having served in state government and in a number of nonprofits. And so, Director Clabaugh, please. So we're streaming, I think. So if you could put this on too, we can catch that audio. Okay. Thank you. It's a double deal. Thank you.
All right. Good morning.
Morning.
Great to be with you this morning. Thank you, Jeff, and appreciate also being here with Director Wise. The partnerships that we have are critically important to all the work that we do, so we appreciate our state government partners and our nonprofit partners as well. Everybody's pulling in the same direction. The mission of the Department of Public Health is to protect and improve the health of Iowans, and as the lead state agency for brain injury, the department is not only working on reducing concussion as a public health issue, but also coordinating public awareness about that very important topic and thinking about how systems need to change in order to address these key issues. And doing that, as I mentioned, with key partners like the Brain Injury Alliance, the Governor's Council on Brain Injuries, and the Department of Education. One way that the department builds partnerships is through, for example, the distribution of bicycle helmets through our Emergency Medical Services for Children program. And this really gives us a kind of a two-pronged opportunity to touch kids, both providing bicycle helmets for children who need those so that they're protected from those injuries, but also gives us an opportunity to open the door to further create awareness and education for those children, their families, and folks in the community on what we know is a very important program and a very important topic. And so as part of that, also connecting those individuals and families with the Brain Injury Alliance Resource Facilitation Program, which is another critical investment that we support. Over the past several years, there's been an increase in conversations, as you all know, and recognition that the impact of concussion is a clear health issue. And I think Jeff mentioned in 2011, for example, Iowa passed a concussion law that required specific groups to get together and really receive information and provide education on recognizing concussion signs and symptoms, as well as specifying requirements for the safe removal, medical release, and return to play of student athletes. And again, Jeff mentioned football is kind of a critical issue, not only for professional players, but also for our kids as well. In the time since the implementation of the law, the conversation, of course, has continued to grow. And again, Jeff mentioned the NFL study that was just, I think, last week that information came out. Individuals working with and supporting Iowa's youth have had additional questions regarding the best practices for concussion prevention and management. And of course, again, I appreciate Director Wise's engagement with our staff and his staff and the Brain Injury Alliance and other partners in developing and issuing the concussion management guidelines recently as well. Last week, Governor Reynolds proclaimed August to be Concussion Awareness Month, and so this is the first time we've also had a proclamation, and I want to take a minute, it's fairly brief, and just read the Governor's proclamation. Whereas concussions are a type of brain injury that can be caused by a bump, blow, or jolt to the head, and whereas the Centers for Disease Control and Prevention estimated that 1.6 to 3.8 million sports and recreation-related concussions occur in the United States each year, and whereas the seriousness of concussion should not be minimized, and whereas concussions can affect a person's physical, emotional, cognitive, and social well-being, and whereas return to learn and return to play protocols utilizing a multidisciplinary team approach should be established and followed for Iowa's youth, and whereas when concussions are properly recognized and managed within the first few weeks after the injury, the majority of individuals have improved outcomes. Now therefore I, Kim Reynolds, Governor of the State of Iowa, do hereby proclaim the month of August 2017 as Concussion Awareness Month. So we also appreciate the governor's willingness to bring additional attention to this as an important issue for Iowa. Thank you, Jeff. Thanks for your staff at the Brain Injury Alliance for putting this event together today and for your continued partnership to continue to highlight the important work for concussion management. And thanks to all of you for attending today. We know that this kind of a meeting takes you also away from the important work that you do, but we appreciate your investment of time here both to learn and to share what we can continue to do in working as partners as we develop continued focus on this important issue. Thank you very much.
All right, I did mention the Department of Education has a history across the country of being out front in pediatric brain injury. And one of the things that we'll be presenting this afternoon, actually Maggie Ferguson, who is our Brain Injury Service Program Manager and longtime champion of things brain injury in Iowa, actually preventing brain injury in Iowa, it will be presenting some of those the concussion management guidelines this afternoon at 2:30. But Brian Weiss is here with us from the Department of Education, so please, if you could give us a few words.
Great. Well, thank you, Jeff, and good morning to all of you. It's really an honor to be with you today talking about this important issue that impacts the health and academic success of Iowa students. In addition to being director of the Iowa Department of Education, I'm also the father of two young sons who are 8 and 11, incredibly active in sports. I also have the pleasure of serving on the Iowa High School Athletic Association Board of Directors. So I come at this issue as an educator, as a parent, and as someone that's really engaged in athletics in Iowa. So thank you for taking this on and inviting me to share a few remarks. So as a state, our shared goal is to ensure students who have suffered a concussion receive the right support, not just in returning to the playing field, but especially in returning to the classroom. We know that recovery doesn't end when a student has gone back to school following a concussion. The effects can linger for weeks through symptoms such as sensitivity to light and noise, loss of concentration, and fatigue. Students may need breaks from the classroom to manage these symptoms. It's critical to support accommodations for the health and well-being of students while also making sure they stay on track academically. Without the right support, students can quickly become overwhelmed trying to catch up on lost time and on homework. This can interfere with their ability to succeed in school. This is why Iowa has taken a community approach to transitioning students back into the classroom following concussions. We recognize that the transition is more than a school nurse or athletic trainer or teacher or parent can manage alone. It truly takes a team. It was our department's honor to team up with Director Clabaugh and other partners in this effort, Director Clabaugh's Department of Public Health, the Brain Injury Alliance of Iowa, in endorsing a post-concussion management model called REAP, which stands for Remove, Reduce, Educate, Adjust, Accommodate, and PACE. REAP brings together a student's family, school, and medical team in support of recovery, regardless of whether the student suffered a concussion in athletics or on the playground or at home. As a state, we've now built on the REAP work by recognizing that schools need support to put community-based concussion management programs into practice. That's why our newly released concussion management guidelines for Iowa schools, that's what they're designed to do. These guidelines outline recommended steps to bridge the concussion management work of a child's healthcare provider and family to the work underway in schools. When schools have good concussion management protocols, they know how to respond when a student experiences a concussion. They're facilitating a culture of communication between student, family, school, and medical team. This culture of communication gives students and families peace of mind because they know where to go for help. This will go a long way in protecting the student's recovery, health, and academic success, which is the overall goal. So again, thank you to all of the partners who have contributed to the new guidelines for schools and for making Iowa a leader in post-concussion management in our schools. Thank you and have a great day.